Hi, I'm Dr. Dan Drake. I'm a family physician that's going to be joining Scheurer in the summer of 2021. The people are incredibly friendly here, which is something that, the majority of hospital systems will strive for, but it's really hard to maintain. I can't, as a student, it blew me away at how friendly people were here when I was working. The medical staff is phenomenal. I think I've worked with, at least up until I was done with med school, I'd worked with all the family docs, at least for the system. Absolutely loved it, every single one of them. And the fact that the system was also family medicine centric too was a big appeal to me personally. On top of that, hospital leadership was great. There was this integration, at least between leadership and the medical team, that I didn't really see anywhere else. I love the idea of that old-timey doc who would go around and visit houses, with a doctor's bag. That really stood out to me. It's something that you kind of aspire to do, and it doesn't happen too much anymore at all. But the fact that you're able to serve a community that you really, you can feel the weight of your actions and help people out. In a metropolitan area, I feel like even though you can know your patient panel, you still kind of lose yourself amongst the crowd. And it's not to say in a rural area I'd ever want to stand out. I don't want that at all. But the big thing is you can feel that you're making an impact. On top of that, it's needed. There's just a huge deficiency in rural docs. And it's not just family physicians, but it's everybody across the board. Obstetrical deserts are a big conversation right now for rural medicine in Michigan. Docs are needed everywhere in these rural communities. People tend to go to cities, rural areas need help, so we gotta help. But I feel like family docs in particular know their patients very, very well, and know their families very well, the patients' families very well. On top of that, it's longitudinal care. And so when you build these relationships with patients over years, and you get to know them, and you know what their struggles are at home, and you know what drives them, it makes it a lot easier to take care of them, At least it makes my job a lot easier, because you can speak to some of that home stuff. It just helps provide good care, I guess, is the biggest thing. You get the whole picture of a patient by being a family doc. For me, that's a big motivator, at least in the job that I do. The other component of that is just the medicine itself. For me, I absolutely love medicine. And so to be able to get up and do a job that I love and to take care of people that I know really well and feel like I'm helping them, that I can walk along their life with them, it's a great job. That's really why I get up in the morning. To be sure would be really integration of healthy lifestyle plus ease of access to healthcare. That's to be sure, at least. It's being part of the community. That's a big component of this place. That's, again, one of the big drivers as to why I wanted to come here. It felt much less corporate than any other health system, that I've seen. It's a unique health system that not only raises quality of care, but also brings ease of access for patients and promotes community living in a way. I'm Dr. Dan Drake, and I can't wait to be Scheurer.